people living in the UK who have a medical condition or issues with their teeth could be made exempt from conscription into the army. From neurological disorders to kidney and urologic problems, there is a long list of conditions that make you exempt. Some are pretty common in the UK. Many will be wondering what they are after the head of the British Army warned Brits may have to fight if the UK went to war. General Sir Patrick Sanders delivered a speech telling ministers they need to mobilise the nation if war breaks out with Russia, reports the Mirror. The chilling thought comes amid growing concerns the UK don't have enough troops and are not prepared in an event that this should happen. During World War I and World War II, the UK has used conscription and used national service up until the 1960s. In the past, people have been chosen for conscription based on their age, sex, job and have been excluded if they suffer from certain medical conditions. The Army says, being in the Army can be challenging both physically and mentally. Therefore, a history of health problems or the presence of health conditions that usually don't affect your everyday life, can mean that you're not able to join, or you might have to wait to join. The PM has ruled out the possibility of conscription. Rishi Sunak's official spokesman has said hypothetical scenarios about future conflicts are not helpful. When asked conscription in the future, the number 10 official added, "There is no suggestion of that. The government has no intention to follow through with that. The British military has a proud tradition of being a voluntary force. There are no plans to change that. But what are the conditions that could see you left off the list? The British Army has 60 illnesses and complaints that would rule people out of fighting for the country, which is not limited. What conditions could exclude you from conscription? Heart disease. Around 7.6 million people in the UK are currently living with heart and circulatory diseases. According to the British Heart Foundation, an ageing and growing population in addition to improved survival rates could see these numbers rise. Heart disease is the term for what happens when your heart's blood supply is blocked or interrupted by a buildup of fatty substances in the coronary arteries. Over time, your arteries' walls can become blocked with fatty deposits. This process is known as atherosclerosis and the fatty deposits are called atheroma. Along with heart disease, hypertension or an abnormal heart rhythm are other cardiovascular problems that could lead you to be excluded from conscription. Food allergies. If you have a food allergy, your body's immune system will react unusually to specific foods and you'll have a range of symptoms depending on the food and individual. Although allergic reactions are often mild, they can be very serious and the Army could stop you from joining if you are unable to eat certain foods. The Army states, you can still apply to join the Army even if your medical history includes one or more of these conditions. The medical team assess everyone individually, and make their decisions based on their professional opinion in keeping with prescribed Army standards. Piles. Hemorrhoids, also called biles, are swellings containing enlarged blood vessels that are found inside or around the bottom, also known as the rectum and anus. This is thought to be caused by too much straining on the toilet, due to prolonged constipation, which could be associated with a lack of fiber in a person's diet. Chronic, long-term, diarrhea can also make you more vulnerable to getting hemorrhoids. Hemorrhoid symptoms often settle down after a few days without treatment. If you get them during pregnancy, they will likely get better after giving birth. Back problems. Back pain, particularly lower back, is very common, and whilst it can improve within a few weeks, sometimes it can carry on for a bit longer, or keep coming back. The Army would exclude people from joining if you have specific problems which, for example, required surgery, or if you have a chronic condition. It's not always clear what causes back pain, and it can often get better without the need to a doctor's visit. Sometimes, however, medical conditions like a slipped disc, sciatica, a trapped nerve, or ankylosing spondylitis can cause back pain. Very rarely, back pain can be a sign of a serious problem such as a broken bone, cancer, or an infection. Diabetes. More than 5 million people in the UK are thought to have diabetes of some form. This is where a person's blood sugar level to become too high. There are two main types of diabetes. Type 1 diabetes is a lifelong condition where the body's immune system attacks and destroys the cells that produce insulin. On the other end is type 2, which is where the body does not produce enough insulin, or the body's cells do not react to insulin properly. Type 2 diabetes is more common than type 1, with over 90% of all adults in the UK diagnosed with type 2. High blood sugar that develops during pregnancy is known as gestational diabetes, and it usually goes away after giving birth. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up, and no one can send messages except the Daily Record team. All you have to do is click here if you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. Full list of conditions exempting you from Army back problems, history of spinal surgery, structural abnormalities of the spine and spinal cord, history of chronic or recurrent back pain, blood diseases, sickle cell disease, congenital spherocytosis, thalassemia, hepatitis B or C, leukemia or malignant lymphoma, disorders resulting in abnormal coagulation, bone or joint problems, knee injuries and chronic knee pain, history of bone fractures, shoulder problems resulting in functional limitations or restrictions of movement, loss of a limb. Clubfoot, including past surgery, chronic joint diseases such as ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis or gout, hypermobility syndrome, cardiovascular problems, diagnosis of heart disease, bicuspid aortic valve, symptomatic or medication-suppressed abnormal heart rhythms, cardiomyopathy, hypertension, dental health, mouth, teeth and gums, poor dental hygiene, including needing the removal of teeth or ongoing treatment, ear problems, current perforation of eardrum, chronic ear diseases like cholesteatoma, presence of eardrum grommet, deafness or hearing problems, eye problems, chronic eye conditions such as glaucoma, keratoconus and retinitis pigmentosa, damage to the eyelids affecting vision, chronic conjunctivitis, reduction of corrected vision in one eye below Army entry standards, diplopia, gastrointestinal problems, chronic abdominal diseases like Crohn's disease or ulcerative colitis, significant history of dyspepsia, loss of spleen, splenectomy, active hemorrhoids, kidney and urologic problems, congenital kidney diseases / anomalies, history of kidney problems such as as malfunction of a kidney or kidney stones, recurrent renal colic, history of urinary incontinence, history of genital infections, neurological disorders, epilepsy, history of head injury with neurological sequelae, migraines, multiple sclerosis, psychiatric problems, schizophrenia, obsessive-compulsive disorder, alcohol or drug dependence, personality disorders, eating disorders, anxiety and depression, post-traumatic stress disorder, PTSD, history of deliberate self-harm or suicide attempts, respiratory problems, asthma, depending on severity and need for treatment, chronic lung disease such as emphysema, bronchiectasis or cystic fibrosis, tuberculosis, skin problems if you suffer from skin conditions such as severe widespread psoriasis or dermatitis. However, if it's mild or moderate dermatitis, it may be considered. Other conditions being an organ transplant recipient, food allergy requiring you to avoid some foods in your diet due to allergy or intolerance, not because you don't like it, Raynaud's phenomenon, diabetes, some medical conditions requiring long-term medication or replacement therapy, moderate or severe COVID-19 infection. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.